Hello and welcome. You're watching Herald TV and this is Dotor in the house. And today we are going to discuss slip disc. And with me I have Dr. Sheldon Pereira, who is a bachelor's in physiotherapy from KLEs and has completed his master's from Mangalore, and over the last 16 years has been practicing in Goa and currently runs a physiotherapy clinic called Physiologic, which is based in Bambolim on the Bambolim Santa Cruz Old Highway. Welcome to the show, Dr. Sheldon.
Thank you, Shoaib.
So beginning with this very important episode which people have been looking forward to as we have received so many questions, let me ask you firstly, what is slip disc? Let's get into that. And can it actually be called slip disc?
Slip disc is, we all know it, slip disc is the term that has been used for years together now. And yes, of course, slip disc is a misnomer, and the correct medical term would be disc herniation.
Okay.
So why it cannot be called slip disc is because the disc actually never slips. It is firmly attached to the bones, to the vertebra above and the vertebra below. So it's very firmly attached, and it's very difficult to detach it.
So when you say it is firmly attached, since we have a model with us, can you actually just show our audiences what it actually is?
Yeah, definitely. That would be very nice. Now here, as we see this, you can see this is the vertebrae, the white colored, the bones here, these are the vertebrae, and in between that is the disc. These are the discs. Okay, these are the discs. Now this disc is so firmly attached to the bone or to the vertebra below and to the vertebra above, so firmly that you cannot actually pull it apart. And when we say slip disc, it is actually the internal content of this that starts seeping out. It's kind of almost like a leakage, and it's trying to push through the outer band. This is the outer band here, very strong band. It goes round. It's a very strong band. And as you can see here in the model, they have like colored it red to show the bulge.
Okay.
So the disc is bulging. It's being pushed outwards by the internal content.
Okay.
It's like, when you overinflate the tire and there's a weak spot in the tube, then what happens? It kind of starts bulging out. That is exactly what happens here. And it bulges out and it starts touching the nerve root here. This yellow structure that you can see is a nerve root which is coming out from the right side of the spine. And it's touching it, and then this nerve starts hurting. And every symptom related to it, it could be the muscle weakness, it could be a weird skin sensation, sometimes pins and needles, sometimes numbness.
Exactly. So my second question was going to be on that. What are the symptoms of a slip disc? And related to that, we have a query from one of our audiences, Kishan Shedgaonkar from Morjim. He also has a similar question. Let's listen in.
Yes.
Hello doctor, my name is Kishan Shedgaonkar. I'm from Morjim. I wanted to ask about the disease slip disc. I wanted to know what are the initial symptoms of this disease.
Yes, doctor.
Okay, so Kishan has directly brought on to the, we are
to the point.
We are spot on this. So the first symptom is that the patient experiences a little bit kind of like a backache. Sometimes it may be, to start with, it might be a dull ache. And the severity is not almost immediate, but sometimes it builds up, over time or with days or with weeks sometimes. Depends on how the person has got it, how severe the cause of this. It could be a trauma, or it could be a fall, or it could be lifting something heavy or doing weights. Sometimes this is like experienced a lot in the gym actually these days, because people are really pushing themselves. And so the symptoms can really be varied. Okay, it can be something as mild as a dull ache, or it can be as severe as a shooting pain which travels down. Now, if the slip disc is in the neck, then the pain shoots down through the arm. If it is the back, then it can shoot down through the lower leg.
Okay, so because this, as you just pointed out, could be from the neck to the lower back, because normally people think that slip disc is only on the back
area.
So this is supposed to be basically from your neck point to the lower back, anywhere in the spine.
Anywhere in the spine, more in the neck and the lower back.
Okay.
The thoracic or the area where the ribs are there, the possibilities are very less.
Okay. And so what are the major causes? I mean, because as you said, one is about the gymming. Just to add to it, thanks to our very good roads that we ride on these days, a lot of two-wheeler riders especially, they always complain about backache.
Yes.
So is extra stress and movement on the back one of the causes?
Of course, definitely, absolutely. Like rightly said, that when you travel on a road with too many bumps and like especially a two-wheeler, like two-wheeler is not really designed to absorb all these things. So four-wheeler, because of the distribution system and you being sitting away from the wheel, so this helps. But on the bike, you're sitting literally on the wheels. So the sharing of force goes right through the spine, and yes, those who are actually bike riders, they are susceptible to get this more often. But if you have a right posture, and if your strength in your muscles of the spine is good, then you can actually manage it better.
Okay. So is in that case every low back pain a slip disc issue, or how do you diagnose it?
Not necessary. Not every low back pain is a slip disc. Low back pain, we'll have so many differential diagnoses, so many reasons could be there. But the most important differential diagnosis when it comes to slip disc is actually sacroiliac joint dysfunction. So sacroiliac.
Yeah, you're getting into medical term. If you could just point out on the
I will
model.
Bring the model once again here. So as you can see here, this is the back portion of the spine.
Yeah.
Okay. This is the back portion of the spine, and this is called the sacrum. Sacrum is actually the bone that forms the tail, and then it goes like below to complete it as a coccyx, we call it, the tailbone. Many people, when they land on the buttocks or the area between the buttocks and they land and they get the pain, that's actually the coccyx. Now, coccyx is not exactly shown here, but we are just looking at the sacrum. Now, sacroiliac, meaning there's a bone called as ilium, which comes and sits over here.
Okay.
And another bone on the other side. So this is the left ilium, this is the right ilium.
That forms our back, basically.
That forms
lower back.
The pelvis actually,
pelvis,
pelvis. So this is the pelvis actually. So this area articulates, moves to form the SI joint, also the sacroiliac joint.
Okay.
So this movement, if it goes wrong, if it either it is shifted up, it's shifted down, in, out, or it is turned in or turned out, altogether 6 abnormal movements, then that could lead to something that could mimic a slip disc. Okay. Why? Because the nerve supply, the nerve that gets affected is a sciatic nerve. In both the conditions, the sciatic nerve will be compressed.
Okay.
Both the conditions. Most of the time it is that. Rarely it could be something else. Yeah.
So, and what are the treatment options that we have for slip disc?
Slip disc basically, like I said last time also, that we can approach it from the pharmacologic basics. You can go to the physician can prescribe muscle relaxants, painkillers, anti-inflammatory drugs, and can bring down the swelling and the pain and the muscle spasm. But then if the patient does not respond to that, then he might have to go to an orthopedician who is going to do a scan, MRI scan maybe if needed, but mostly they start with an X-ray. And if the X-ray is, like giving indications that there is a slip disc or a reduction in the intervertebral joint space, then he might look into the possibility of going for a MRI for further clarifications. Now, if the MRI is not very severe, then the surgeon will choose to use some conventional methods. Okay, it could be physiotherapy with pharmacologic measures. Mostly it's a combination of both these things. And then if it is really severe and if the patient is not really responding to this, then the last option is actually surgery. But conventional methods should always follow and should precede a surgical approach.
Okay. And in this case, what are the possibilities of recovery vis-a-vis conventional methods, that is including physiotherapy versus a surgery?
Most of the patients, 80% of the patients with disc herniation, they respond to conventional therapy like either pharmacologic measures and physiotherapy or the combination of both. Okay. Rarely, mostly 15 to 20% might require surgical intervention to correct this.
So, while you say that 80% of them respond, but with the surgery, are there, these are all chances that it won't reoccur, or there are chances that a slip disc can reoccur? What is the chances of that?
See, usually once they do a surgery, they have got procedures which are called as discectomy, wherein they remove a portion of the disc, or they have a procedure called as laminotomy, wherein a small portion of the lamina, portion which I can show on the model later, they kind of chip it out. And then the third procedure is laminectomy. Laminectomy is quite invasive, and it takes a big portion of the bone from that particular vertebra, and opens up the space, so that the nerve has a lot of area to move. But as you have asked me that are there any cases wherein we see recurrence after these surgeries? Yes. In fact, many of them, in fact, most of them have recurrences.
Oh.
Okay. So hence that is the reason why these are not the first line of treatment.
The most preferred ones.
The most preferred one.
Okay.
So the surgeon also knows about it, and he would always like to take it slow on these kind of decisions.
So if moving back then to the conventional method, so what are the methods within physiotherapy that are used to treat slip disc?
Okay, physiotherapy basically...
And, just before you move ahead, I have another question just related to this. Our viewer Shannon Nathan has asked us a question.
Yeah.
Hello, doctor. My name is Shimran Nathan, and I'm from Porvorim. My mother has been suffering from back pain, and she's unable to sit, bend, and do all these normal activities that she's supposed to do around the household. Can you please tell us some home remedies or something that will help relieve her pain?
Okay, Shannon has asked something really big, because if it is something got to do with the disc herniation, then basically she needs to see a specialist.
Okay.
But sometimes that option is not there, you understand, and you need to buy time. So if you are speaking about buying time here, then the best thing would be actually sleeping on the bed, on the back, as long as possible. Because resting on the supine position, that means sleeping on the back, is going to be the most beneficial position right now. What we can add on to the supine position is if we can lift up the legs.
Okay.
Bend the hip at 90 degrees, bend the knee at 90 degrees. So if the patient is sleeping here, so the hip will be bent at 90 degrees and the knees will be bent at 90 degrees, and place a stool or a chair or add some bolsters so that the knee is lifted up. That position is going to help in actually relaxing the lumbar spine from an exaggerated lordosis to a more neutral one. And that gives a lot of relief actually.
So this, just to add to that, I mean, to come back to that question as to the methodology that is used in physiotherapy. So while you are giving a specific answer to Shannon's question, apart from this, there's anything specific that people should be aware of when it comes to physiotherapy methods?
Yeah, there is another. This is now the supine position. There is another something called as prone. Prone meaning is actually sleeping on the abdomen.
Okay.
So sleeping in the abdomen is a position that has been proven time and again as per there's something called as Mackenzie's technique. So Dr. Mackenzie was the guy who actually brought out this concept, and it is widely used actually. And he suggests, and yes, there is research evidence to show that it works, that in the prone position, when you sleep on the abdomen, it really helps the disc to go back to its parental original site. So even if the disc has come out from this area, the disc tends to go back inside.
Okay.
Go back inside. When you sleep prone, it means on the abdomen. And many of the physiotherapeutic exercises are done in prone. For slip disc, it's a thumb rule that all the exercises, 90% to 95% of the cases, will have to be done in the prone position.
Okay. So, doctor, at this point, we'll take a break. And on the other side, we'll discuss more about slip disc and how we can prevent it, the prevention of slip disc, as well as there are more questions that our audience are having.
Of course.
So, please not go away. Keep watching Herald TV. We'll be right back. Welcome back. You are watching Herald TV, and today we are discussing slip disc. जे आमी म्हणटा मणी सरकल्या, आणि म्हजे बरोबर आसा डॉक्टर शेल्डन परेरा. डॉक्टर, बिफोर गोईंग इन टू द ब्रेक आमी उलयताली मणी सरकप आनी मागीर ताजे कॉजेस कशें कितें घडटा, आमचे सगळ्यांक बॅक पेन जाता, फाटी दुखता. सो एक क्वेश्चन येता की खूबशे लोक, यू सेड दॅट ओनली 20% ऑफ द केसीस मे रिक्वायर सर्जरी, बट even after surgery केल्या उपरांत सुद्धा physiotherapy is a requirement or not?
Absolutely a requirement. We have got something called as spinal rehab protocol, wherein we have to follow certain exercises. म्हणजे हे करचेच पडटा, and there are certain specialized hospitals in the metropolitan cities particularly, wherein they have a team of rehab specialists, including physiotherapists, occupational therapists, then sports medicine experts, who are just dealing only to get the patient back in track. It's not like you are not just correcting the surgical issue there, but you are seeing that the patient can bounce back to his life again. So it's something that it's mandatory, and sometimes it doesn't happen, unfortunately, but yes, like spinal rehab and physiotherapy following surgery is a must.
So when you say that there are so many protocols, so what are the physiotherapy techniques normally included in treating slip disc?
Okay, now after spinal surgeries, basically we never use the device, like spinal traction is not used much, or nobody advocates that, because we are already if it's a laminectomy wherein a portion of the bone of the vertebra has been removed, so that can bring the structural integrity or stability into question, and hence we will not be I don't think so anyone will be free to or will feel comfortable in using that, and it could be risky for the patient. So like spinal traction or lumbar traction, what we commonly called as.
If you can just tell us what happens exactly when you talk about lumbar traction, showing us the model.
Yeah. So in lumbar traction, what happens is that when we put the patient on lumbar traction, this is what happens in the physiotherapy department. So the patient is lying on his back, and his hips are bent at 90 degrees, knees at 90 degrees, like how I said, and a stool is placed, and a harness goes around his waist. That harness is attached to the motor. The motor pulls, and we decide how much traction weight is to be applied and for how long. And as it pulls, it separates the vertebrae, hence increasing the space between two adjacent vertebrae, and we create a negative pressure like a vacuum. So that vacuum then sucks back the disc. That is actually the theory behind lumbar traction, which is also called as decompression therapy in the Western countries. We know it as traction, but in the US they call it decompression therapy. And of course, there are beds which are very complicated, which they use. We use a simple model, either the 3-piece or the 3-fold or the 2-fold models, but they use complicated ones, which are very expensive also to purchase actually. So basically we are trying to create a negative force in order to suck the disc back inside.
Okay. And now this is surgeries and physiotherapy, but normally when we have backaches or people who are already suffering, for temporary relief they use relief sprays. How effective they could be? And before you answer that, we have 2 questions related to this issue. So let's listen to them.
Yes.
One is Rachel Rodriguez, and the other one is Pramod Sardesai.
Okay.
Hi doctor, this is Rachel Rodriguez from Talakau, and I had a question regarding the relief sprays we use when we get back pains. I mean, I wanted to know if it is advisable to use relief sprays without any consultation as and when we get back pains.
We'll listen into Pramod Sardesai also.
Okay.
हॅलो दोतोर, म्हजें नांव प्रमोद सरदेसाय, हांव केपेंसान उलयतां. आनी म्हज्या बापायक ते स्लीप डिस्काचो प्रॉब्लम आसा, ते मणी म्हणटात ते. सो जेन्ना तो ते पेन रिलीफ स्प्रे मारता पळय, तेन्ना ताका एक ते 2 वरां खातीर मातशें बरें रिलीफ असो दिसता, बट आफ्टर दॅट ताका परत तोच प्रॉब्लम परत स्टार्ट जाता. सो ताका कितें उपाय आसा?
As I said, people are using relief sprays, but a lot of times they are not as effective. So, and firstly, whether they can be used, how many times, because as you said, it's after 2 years, as Pramod asked, 2 वरां मेरेन फक्त ताका रिलीफ दिसता, परत ते सुरू जाता. So what is the option?
This is a very genuine query here, basically what happens when someone is in pain, he wants relief. That is the first thing. And nothing better than relief sprays, because you are not putting it into your system, it's just an external application. So the advantages are more than the disadvantages. But what happens is that when the pain is recurrent and you are not finding a solution to the pain and becomes nagging and more repetitive, that's the time he needs to go back to the doctor and he needs to check whether if they are dealing with something else, or just something ordinary like muscle spasm, or he has strained a muscle, or he has sprained a ligament of the back. So this could be something that can be like dealt naturally. Sometimes when you get a spasm, you rest it out, it goes, or you take a muscle relaxant, you go, or if you apply like a pain relief spray, it goes. But then if it's coming on again and again, there could be something underlying that we need to cross check.
Okay, so it could be would it be a prolapse of
there is a possibility, mostly.
and how do we then prevent it if that is the case?
Okay.
And before you answer that, there's a question which is related to the question that I asked you, how to prevent this, and that is from Meena D'Souza. She has a question for you.
Okay.
Hello, doctor. I'm Meena D'Souza, and I wanted to know, like, when someone is suffering from slip disc, what should be avoided? Like, what should be not done when you get slip disc?
So her question is, when you are already having slip disc, what should be avoided?
Yeah.
And then you can answer my question.
Yeah. I think so. The answer will be the same for both the conditions,
Okay.
whether you have a slip disc or you don't have a slip disc. These are the don'ts, particularly pertaining to activities. You are not supposed to bend. Okay, bend from the back. Like when we are picking up something, we have a tendency, by keeping the knee straight, we right away we reach down to the floor and we pick it up.
Okay.
That should not be done. Okay, point number one. Point number two, avoid getting common cold as far as possible, because what comes along with common cold is sneezing and coughing, and it's going to be this kind of an action again and again, repetitive. So you are again going into bending kind of motion, and that aggravates the slip disc. The third thing what we do is commonly is that when we sneeze, and if you are talking to somebody, to avoid any kind of nowadays, since because of COVID, it's like a complete no, and so you turn away and then you bend and you sneeze. So like when you are sneezing with a twist, that is going to be the worst position for the spinal disc, and the disc is pressurized, and the disc can even get slipped at that very moment, in that moment of that second.
Also, a sneeze also can cause it.
Definitely. In fact, in many like if the patient is sharp enough to actually notice it, many times that's a history. Okay. Sometimes like another thing to be avoided is actually lifting heavy weights. So if you have the right form, or you know the method to lift, you're sharing the weight on your legs, you're sharing the weight on the muscles of the shoulder, and to brace your spine. Like when a weightlifter lifts, they lift heavy weights, 230 pounds, 300
No,
pounds.
actually, that is what I was going to ask you, because there are 2 points that you pointed at. One is, bending your back, keeping your knees straight.
Yeah.
Normally, as school children, we were always told to do that as one of the exercises.
Exercises, correct.
So, continuing that in your adulthood could cause you a slip disc.
If you're doing it very briskly, yes.
Okay.
You got to be slow, and you got to also respect your age, and and you understand what I'm going to say. So nothing is wrong,
Okay.
unless until you do it wrong.
Okay.
So lifting heavy things is not bad. We need to lift things. We lift things. Sometimes we have to lift buckets. We have to lift flower pots. We have to lift things, furniture in the house when you're doing things. Sometimes we got to like move weights around, but if you do it in the right form, if you know to brace your muscles, then it's always going to protect you from a slip disc.
Okay.
There are many people who do it all of a sudden with a jerk. They lift something. They do not give time to the body to prepare. Even when you're lifting shutters up and on, people who own shops and who have to lift shutters up, they do it with a jerk. They should actually do it with bent knees and then push up with the knees straightening.
Okay.
Rather than keeping the knee straight and then lifting it through the back. They have to lift up the shutters by straightening up the knees actually. That is the right way to lift any weight.
My last question would be, again, with regard to preventions, but everything is nowadays related to lifestyle.
Yeah.
So, how our daily lifestyle routines can affect slip disc? I mean, how it can cause, and as well as how we can prevent ourselves, if you do not have yet, how we can prevent ourselves from getting into.
This is a very nice question actually. I had not thought about this. But how do we sit, how do we stand, how do we walk, how long do we sit, and how do we sit.
Okay.
Is like something that's going to come into the picture now, because nowadays we are using the tabs, we are using
Yes,
mobiles, we are
yes.
on the laptops, we are constantly viewing something on social media, so we are always like this. So many people tend to get the slip disc of the neck.
Okay.
Those who are studying for prolonged hours, some people are into like reading, particularly those who are into performance examinations and all, you read a lot, you put your head down, so the angle at which you view the book or the tab is very important. It's good if you always try to incline something up, like so that you keep your head a little bit more upright than bent forward.
Okay.
Also sitting example, some people they like watching or viewing their like phones by slouching on the couch and on the sofa and like very weird positions, but these are the people who are susceptible to get a slip disc. Also those who are like sitting for many hours on the desk, like doing serious like job wherein they do not have the time to focus on the form of their posture. So they are bent forward, they are doing something, or like sometimes do the tailbone sitting, rather than sitting on the buttocks, you are sitting on the tailbone. So these are the people who are prone to get a slip disc.
So it's very important that we take care of our lifestyle
Yes,
also.
absolutely right.
Please watch this episode on 17th July at 11 a.m. on all our social media platforms. It will be uploaded there as well as on Herald TV. So our next episode will be on brain stroke. So do send in your queries. Until then, keep watching Herald TV. We will be back again next week with the next episode of Dotor in the House. Take care. Goodbye. Take care of your health and keep watching Herald TV.